Welcome, dear friends, to this important conversation about a topic that touches the lives of so many men as they enter their golden years. Today, we're going to talk openly and honestly about male sexual health after 60. Now, I know this might make some of you a bit uncomfortable, but let me assure you, there's absolutely nothing to be embarrassed about. Sexual health is an integral part of our overall well-being, and it's high time we break the silence surrounding this crucial aspect of life. As we age, our bodies naturally undergo various changes, and our sexual function is no exception. But here's the thing. Getting older doesn't mean you have to bid farewell to a satisfying sex life. Far from it. With the right knowledge and approach, many men can continue to enjoy intimacy well into their later years. That's exactly why we're here today. To arm you with information, dispel myths, and provide practical advice to help you maintain or improve your sexual health. Now, let's start by acknowledging something important. If you're experiencing changes in your sexual function, you're not alone. Millions of men around the world face similar challenges as they age. It's a natural part of life, but that doesn't mean you have to simply accept it without taking action. There are many things you can do to address these changes and improve your quality of life. Before we dive into the details, I want you to know that this video is created with you in mind. We'll use simple, easy-to-understand language, and I promise to explain any medical terms in a way that's clear and relatable. My goal is to make you feel comfortable, informed, and empowered to take charge of your sexual health. Throughout this video, we'll cover 10 essential topics that are crucial for understanding and improving male sexual health after 60. We'll talk about the natural physiological changes that occur, common issues like erectile dysfunction, the emotional impact of these changes, and how they can affect your relationships. But don't worry, we won't just focus on the challenges. We'll also discuss practical solutions, from lifestyle changes to medical treatments, that can help you maintain a fulfilling sex life. As we go through this journey together, I want you to remember one thing. You're not defined by your sexual function. You're a whole person with a lifetime of experiences, wisdom, and value. Sexual health is just one aspect of your overall well-being, but it's an important one that deserves attention and care. Now let's begin with our first topic. Understanding the natural physiological changes that occur in men's bodies as they age. As we enter our 60s and beyond, our bodies start to produce less testosterone. This hormone plays a crucial role in male sexual function, so a decrease can lead to changes in libido and sexual response. You might notice that it takes longer to become aroused, or that your erections aren't as firm as they used to be. These changes are normal and happen to most men as they age. But here's the good news. While these changes are natural, they don't have to significantly impact your sex life. Many men continue to have satisfying sexual relationships well into their 70s and 80s. The key is to understand what's happening in your body and learn how to adapt. For instance, you might find that you need more direct stimulation to achieve an erection than you did in your younger years. This is perfectly normal. It's all about adjusting your expectations and being patient with your body. Remember, there's no rush. Take your time and focus on the enjoyment of the entire intimate experience, not just the end goal. Another change you might notice is a longer refractory period. That's the time between ejaculation and when you're able to achieve another erection. This period naturally increases as we age. Again, this is normal and nothing to be concerned about. It just means you might need to plan your intimate encounters a bit differently. Now, let's talk about a topic that's often misunderstood. Erectile dysfunction. Erectile dysfunction, or ED, is the inability to achieve or maintain an erection firm enough for sexual intercourse. It's a common issue that affects many men, especially as they age. In fact, studies show that about half of men over 60 experience some degree of ED. But here's something crucial to understand. ED isn't an inevitable part of aging. While it becomes more common as we get older, it's often related to underlying health conditions or lifestyle factors that can be addressed. That's why it's so important to talk to your doctor if you're experiencing persistent difficulties with erections. ED can have various causes, both physical and psychological. On the physical side, conditions like high blood pressure, diabetes, and heart disease can all contribute to ED. These conditions can affect blood flow, which is crucial for achieving and maintaining an erection. Certain medications can also impact erectile function, so it's worth reviewing your prescriptions with your doctor. On the psychological side, stress, anxiety, and depression can all play a role in ED. Performance anxiety is particularly common, especially if you've had difficulty with erections in the past. This can create a cycle of worry that makes it even harder to achieve an erection. I want to emphasize something here. Experiencing occasional difficulty with erections is normal, and nothing to be overly concerned about. It happens to all men from time to time. However, if it's becoming a persistent issue that's affecting your quality of life, it's important to seek help. There's no shame in talking to a healthcare professional about ED. In fact, it's one of the smartest things you can do for your overall health and well-being. Now, let's talk about the emotional impact of these changes. It's completely natural to feel frustrated, worried, or even a bit depressed when you start experiencing changes. In your sexual function, many men tie their sense of masculinity and self-worth to their sexual performance, so difficulties in this area can be a real blow to self-esteem. But I want you to remember this. You are so much more than your sexual function. Your worth as a person, as a partner, as a man, is not determined by your ability to achieve an erection or have sex. You have a lifetime of experiences, wisdom, and love to offer. Your value goes far beyond the bedroom. That being said, it's important to acknowledge and process these feelings. Talk to your partner about what you're experiencing. Open, honest. Communication can strengthen your relationship and help you navigate these changes together. If you're finding it difficult to cope with these emotions on your own, don't hesitate to seek support from a therapist or counselor who specializes in sexual health issues. Remember, taking care of your emotional well-being is just as important as taking care of your physical health. In fact, they're closely interconnected, especially when it comes to sexual function. Now, let's delve into a topic that's crucial. For understanding sexual health, the connection between cardiovascular health and erectile function. You might be wondering what your heart has to do with your sexual performance, but the link is actually quite strong. You see, achieving an erection is all about blood flow. When you become aroused, blood rushes into the penis, causing it to become erect. If there are issues with your cardiovascular system, the heart and blood vessels, it can affect this process. That's why conditions like high blood pressure, high cholesterol, and atherosclerosis, hardening of the arteries, can contribute to erectile dysfunction. In fact, some doctors consider erectile dysfunction an early warning sign of heart disease. If you're experiencing persistent ED, it's important to have your heart health checked. By addressing any underlying cardiovascular issues, you might not only improve your erectile function but also reduce your risk of heart attack and stroke. It's a win-win situation. So, what can you do to improve your cardiovascular health and, by extension, your sexual function? One of the most effective strategies is regular exercise. Aim for at least 30 minutes of moderate physical activity most days of the week. This could be brisk walking, swimming, cycling, or any other activity that gets your heart rate up. Not only will this help improve blood flow throughout your body, including to your penis, but it can also boost your energy levels and mood. Speaking of exercise, there's a specific type that can be particularly beneficial for sexual function: Kegel exercises. These exercises strengthen the pelvic floor muscles, which play a role in erectile function and ejaculatory control. To do Kegel exercises, simply contract the muscles you use to stop urination midstream. Hold for a few seconds, then release. Aim to do a few sets of 10 to 15 repetitions each day. Now, let's talk about another crucial factor in maintaining Good sexual health, your diet. You've probably heard the saying, "You are what you eat." And when it comes to sexual health, this couldn't be more true. The foods you consume can have a significant impact on your sexual function and overall well-being. A heart-healthy diet is also a sex-healthy diet. Focus on eating plenty of fruits, vegetables, whole grains, and lean proteins. These foods are rich in vitamins, minerals, and antioxidants that support overall health, including sexual health. Foods high in flavonoids, like berries, citrus fruits, and red wine, in moderation, have been linked to a reduced risk of ED. Certain nutrients are particularly important for sexual function. Zinc, for instance, plays a crucial role in testosterone production. You can find zinc in oysters, beef, pumpkin seeds, and lentils. Omega-3 fatty acids, found in fatty fish like salmon, can help improve blood flow, and foods rich in L-arginine, such as nuts, seeds, and watermelon, may help improve erectile function by boosting nitric oxide production, which helps dilate blood vessels. On the flip side, there are some foods and substances you might want to limit. Excessive alcohol consumption can impair sexual function, as can a diet high in saturated fats and processed foods. If you smoke, quitting is one of the best things you can do for your overall health, including your sexual health. Smoking damages blood vessels and can contribute to ED. Now, let's address a factor that can have a significant impact on sexual function but is often overlooked: stress. In our fast-paced world, stress has become almost ubiquitous. But chronic stress can wreak havoc on your health, including your sexual health. When you're stressed, your body produces higher levels of cortisol, often called the stress hormone. Elevated cortisol levels can interfere with testosterone production and sexual function. Moreover, stress can lead to anxiety and depression, which can further impact your libido and sexual performance. It's not uncommon for men to experience performance anxiety, especially if they've had difficulties in the past. This anxiety can create a vicious cycle, making it even harder to achieve and maintain an erection. So, what can you do to manage stress and its impact on your sexual health? First, it's important to identify your stress triggers. Are there particular situations or times of day when you feel most stressed? Once you've identified these, you can work on developing coping strategies. One effective stress management technique is mindfulness meditation. This involves focusing your attention on the present moment, acknowledging your thoughts and feelings without judgment. Regular practice of mindfulness has been shown to reduce stress and anxiety and may even help improve sexual function. Breathing exercises can also be helpful. When you're feeling stressed, take a few minutes to focus on your breath. Breathe in slowly through your nose, hold for a few seconds, then exhale slowly through your mouth. This simple technique can help activate your body's relaxation response. Regular exercise, which we discussed earlier, is also an excellent stress buster. Physical activity releases endorphins, the body's natural mood boosters. Plus, the sense of accomplishment you get from sticking to an exercise routine can boost your confidence, which can translate to improved sexual performance. Another crucial factor in maintaining good sexual health is getting enough quality sleep. Sleep is when your body repairs and rejuvenates itself, and this includes hormone production. Lack of sleep can lead to decreased testosterone levels, which can affect libido and sexual function. Aim for 7 to 9 hours of sleep per night. Establish a regular sleep schedule by going to bed and waking up at the same time each day, even on weekends. Create a relaxing bedtime routine to help you wind down. This might include reading a book, taking a warm bath, or practicing some gentle stretches. Avoid screens, TV, phone, tablet, for at least an hour before bed, as the blue light emitted by these devices can interfere with your body's production of melatonin, the hormone that regulates sleep. Also, try to limit caffeine and alcohol consumption, especially in the evening, as these can disrupt your sleep patterns. If you're having persistent sleep problems, such as snoring or sleep apnea, it's important to address these issues. Sleep. Apnea, in particular, has been linked to erectile dysfunction. If you suspect you might have sleep apnea, symptoms include loud snoring, gasping for air during sleep, and excessive daytime sleepiness, talk to your doctor about getting evaluated. Now, let's discuss the various medical treatments available for erectile dysfunction. It's important to remember that while lifestyle changes can make a big difference, sometimes medical intervention is necessary. And that's okay. There's no shame in seeking medical help for sexual health issues. One of the most well-known treatments for ED is a class of medications called PDE5 inhibitors. These include drugs like sildenafil, Viagra, tadalafil, Cialis, and vardenafil, Levitra. These medications work by enhancing the effects of nitric oxide, a chemical your body produces that relaxes muscles in the penis. This increases blood flow and allows you to get an erection in response to sexual stimulation. While these medications can be very effective, they're not suitable for everyone. Men with certain health conditions or who are taking certain medications may not be able to use them safely. That's why it's crucial to talk to your doctor before starting any new medication. For men who can't take or don't respond to oral medications, there are other options available. These include vacuum erection devices, which use suction to draw blood into the penis, and intracavernosal injections, where medication is injected directly into the penis to produce an erection. In some cases, hormone therapy might be recommended. If your testosterone levels are low, your doctor might suggest testosterone replacement therapy. However, it's important to note that this treatment is only suitable for men with diagnosed low testosterone and comes with its own set of potential risks and benefits. For men with ED caused by psychological factors, counseling or sex therapy can be very helpful. A therapist can help you work through issues like performance anxiety, stress, or relationship problems that might be contributing to your ED. It's worth mentioning that there are also some alternative and complementary therapies that some men find helpful. These include herbal supplements like ginseng and acupuncture. While some men report benefits from these treatments, it's important to note that scientific evidence for their effectiveness is often limited. Always consult with your doctor before trying any new treatment, especially herbal supplements, as they can interact with other medications. Now, let's address some common myths and misconceptions about sexuality in older adults. There's a lot of misinformation out there, and it's important to separate fact from fiction. Myth number 1. Sexual desire naturally disappears as you get older. This is simply not true. While it's normal for sexual desire to fluctuate throughout life, many older adults continue to have active sex lives well into their 70s and 80s. The desire for intimacy and physical closeness doesn't disappear with age. Myth number 2. Erectile dysfunction is an inevitable part of aging. As we've discussed, while ED becomes more common with age, it's not an inevitable consequence of getting older. Many cases of ED are related to underlying health conditions or lifestyle factors that can be addressed. Myth number 3. You're too old to start a new sexual relationship. There's no age limit on love and intimacy. Many older adults find new partners and enjoy fulfilling relationships later in life. It's never too late to seek companionship and intimacy. Myth number 4. Sex is only about intercourse. This is a limiting belief that can put unnecessary pressure on performance. Intimacy comes in many forms, including touching, kissing, and other forms of physical affection. Expanding your definition of sex can lead to a more satisfying and less stressful intimate life. Myth number 5. Talking about sex with your doctor is embarrassing and unnecessary. Your sexual health is an important part of your overall health. There's no need to feel embarrassed about discussing sexual concerns with your healthcare provider. They're there to help you, and having these conversations can lead to solutions that improve your quality of life. By dispelling these myths, we can promote a more positive and realistic view of sexuality in older adults. Remember, every person's experience is unique, and there's no normal when it comes to sex and aging. What matters most is what works for you and your partner. Speaking of partners, let's talk about the importance of communication in maintaining a healthy sex life as you age. Open, honest communication with your partner is crucial. If you're experiencing changes in your sexual function or desire, talk about it. Your partner may be experiencing changes too, and addressing these issues together can strengthen your relationship and lead to solutions that work for both of you. It's also important to be open to trying new things. As your body changes, you might need to experiment with different positions or techniques. This can be an opportunity to explore and discover new ways of giving and receiving pleasure. Remember, intimacy is about connection and enjoyment, not just performance. If you're single, don't let that stop you from prioritizing your sexual health. Self-care and self-exploration are important at any age. And if you're interested in starting a new relationship, don't let concerns about sexual performance hold you back. Many older adults find love and companionship later in life, and with open communication and mutual understanding, these relationships can be deeply fulfilling. Now let's talk about the importance of regular checkups and screenings. As we age, our risk for certain health conditions increases, and many of these conditions can affect sexual function. Regular checkups can help catch and address these issues early. Make sure you're up to date on recommended health screenings for your age group. This might include tests for prostate cancer, cardiovascular disease, and diabetes. These conditions can all impact sexual function, so early detection and treatment are key. During your checkups, don't hesitate to bring up any concerns you have about your sexual health. Your doctor has heard it all before, and addressing these issues is an important part of maintaining your overall health and well-being. It's also important to review your medications regularly with your healthcare provider. Some medications can have sexual side effects, and in some cases, adjusting your medication regimen might help improve sexual function. Remember, taking care of your sexual health is an important part of healthy aging. It's not just about maintaining sexual function. It's about overall quality of life, intimacy, and emotional well-being. As we near the end of our discussion, I want to emphasize that maintaining good sexual health as you age is about much more than just addressing physical symptoms. It's about embracing a holistic approach to health and well-being. This means taking care of your physical health through regular exercise, a healthy diet, and adequate sleep. It means managing stress and prioritizing your mental and emotional well-being. It means nurturing your relationships and maintaining social connections. And it means staying curious, open-minded, and willing to adapt as your body changes. Remember, every person's journey is unique. What works for one person might not work for another. The key is to stay in tune with your body, communicate openly with your partner and healthcare providers, and be willing to explore different solutions. Most importantly, be kind to yourself. Aging is a natural process, and while it comes with challenges, it also brings wisdom, experience, and the opportunity for continued growth and joy. Your sexual health is an important part of your overall well-being, but it doesn't define you. You are so much more than your sexual function. As we wrap up our discussion, let's take a moment to recap the key points we've covered. We've talked about the natural physiological changes that occur as men age, including changes in hormone levels and sexual response. We've discussed common issues like erectile dysfunction, exploring both its physical and psychological causes. We've emphasized the strong connection between cardiovascular health and sexual function, highlighting the importance of regular exercise and a heart-healthy diet. We've talked about the role of stress management and good sleep habits in maintaining sexual health. We've explored various treatment options, from lifestyle changes to medical interventions, and we've dispelled common myths about sexuality in older adults. Throughout our discussion, we've emphasized the importance of open communication with your partner, with your healthcare providers, and with yourself. We've encouraged you to embrace a holistic approach to health, recognizing that sexual well-being is intricately connected to overall physical, mental, and emotional health. Now, I want to leave you with some final thoughts and encouragement. First and foremost, remember that you're not alone in facing these challenges. Millions of men around the world are navigating similar changes as they age. There's no need to feel embarrassed or isolated. By being proactive about your health and seeking help when you need it, you're taking an important step towards maintaining your quality of life. Second, don't be afraid to seek professional help. Whether it's talking to your primary care physician, consulting with a urologist, or working with a therapist, there are experts available who can provide valuable guidance and support. Remember, healthcare professionals are there to help you, not judge you. They've heard it all before, and no concern is too small or too embarrassing to bring up. Third, stay curious and open-minded. Your body will continue to change as you age, and what worked for you in the past might not work now. Be willing to explore new approaches to intimacy and pleasure. This might mean trying new techniques, experimenting with different forms of physical affection, or redefining what's satisfying sexual activity means to you and your partner. Fourth, maintain a positive attitude. While aging does bring challenges, it also brings opportunities for growth, deeper connections, and new experiences. Many people report that their sex lives actually improve as they get older, as they become more comfortable with their bodies and more skilled at communication. Fifth, take care of your whole self. Engage in activities that bring you joy and fulfillment. Maintain social connections. Stay physically active. Keep your mind engaged through learning and new experiences. All of these contribute to your overall well-being, which in turn supports your sexual health. Sixth, practice patience and self-compassion. Changes in sexual function can be frustrating, but getting angry or discouraged only makes things worse. Be patient with your body and kind to yourself. Celebrate the things your body can do, rather than focusing on what it can't. Seventh, if you're in a relationship, involve your partner in this journey. Open, honest communication can strengthen your bond and lead to a more satisfying, intimate life for both of you. Remember, intimacy is about more than just sex. It's about emotional connection, physical affection, and mutual understanding. Eighth, if you're single, don't let that stop you from prioritizing your sexual health. Self-care is important at any age and relationship status, and if you're open to it, don't be afraid to seek new relationships. Many people find love and companionship later in life. Ninth, stay informed. Medical understanding of sexual health in older adults is continually evolving. New treatments and approaches are being developed all the time. Stay curious and don't hesitate to ask your healthcare provider about new developments in the field. Finally, remember that sexual health is just one aspect of your overall health and well-being. While it's important, it doesn't define you. You are a whole person with a lifetime of experiences, relationships, and accomplishments. Your worth is not determined by your sexual function. As we come to the end of our discussion, I want to thank you for your attention and your willingness to engage with this important topic. By seeking out this information, you're taking an active role in your health and well-being. That's something to be proud of. Remember, aging is a natural and normal process. It brings changes, yes, but also opportunities for growth, deeper connections, and new experiences. With the right approach, many men find that their intimate lives continue to be satisfying and fulfilling well into their later years. I encourage you to take the information we've discussed today and use it as a starting point for further exploration. Talk to your healthcare provider. Have open conversations with your partner. And most importantly, listen to your body and honor your own needs and desires. Before we close, I want to remind you that this channel is dedicated to providing valuable, accurate health information to support you in your journey. If you found this video helpful, please consider subscribing to the channel. By doing so, you'll stay up to date with the latest information and advice on a range of health topics relevant to you. Additionally, we'd love to hear from you. If you have questions about the topics we've discussed, or if there are other health issues you'd like us to address in future videos, please leave a comment below. Your feedback helps us create content that's truly useful and relevant to our viewers. Remember, taking care of your sexual health is an important part of taking care of your overall health. It's never too late to start prioritizing your well-being. Every step you take towards better health is a step in the right direction. Thank you for joining me for this important conversation. Here's to your health, your happiness, and to embracing all the opportunities that each stage of life brings. Until next time, take care and stay well.